I think we're due to have about 60, but it looks like we've got about, well, 30 odd already, and I think the numbers are going up. So I know everyone's pressed for time, so we'll make a start. So thank you all for coming today, which I think, as I've said, amazing for a Monday morning. Whether you're a professional carer, a carer at home, someone living with dementia, it's great to see you here today. For those of you who don't know me, my name's Isobel Jones. I'm the CEO at Alive, and we're a charity based in Bristol. I've had the pleasure of working with Mark, he's on my left, and Tony on my right on my screen, from Brace and from Bristol Dementia Action Alliance in putting this event and putting this network together. Before I get the boys to come and share a little bit about why we're working together and what our charities are doing, I'll just do a little bit of housekeeping, if that's all right with you. As I kind of, everyone's probably quite Zoom etiquetted, know what they're doing, but if you can keep yourself on mute until you want to talk, that's fine, unless you're asking a question. Timekeeping, we've got 60 minutes, and we are going to try and keep it to 60 minutes if we can, because we've all got busy lives and lots to do on a Monday. And we do want this, for this one, we don't have that many slides. We've got lots of people talking, but we want people to really to ask questions and input in this. So please use the chat bar for questions as well, but please also just physically raise your hand and I'll keep an eye out, because we want to be open, and I will try and facilitate as many people as possible, because again, we want it to be open. So yeah, we hope you enjoy today and to get something and to really take something out of it. So what is the Bristol Dementia Charities Network? Well, as I said, our charities have come together to work together in a more integrated way. Alive, we're a charity based in Bristol. We've been around for 10 years. We've worked predominantly with older people in care homes and at home, looking at engagement and activity and improving the quality of life. That's kind of in a nutshell what we do. We also offer training for care staff and for people living at home and for carers. So Mark, do you want to share a little bit about Brace, and also, why did we start why did the Bristol Dementia Charities Network come about?
Well, Brace is primarily a dementia research charity, and that means we fund laboratory scientists and clinicians who are seeking variously to understand the causes of dementia, improve diagnosis, achieve earlier diagnosis, and above all, develop new treatments and ultimately a cure. But because science is learning more about the causes of dementia, we believe we have important information to share with the public, new insights that show, for example, how lifestyle affects risk, or how public places can be better designed. And that's why we're involved in public information events like this, and that's why we're very happily working with Alive and BDAA.
That's brilliant. Well, thanks, Mark. Tony, you're from Bristol Dementia Action Alliance. Do you want to share a little bit about what you do, and also what do you think of the advantages of working with other organisations and forming an umbrella organisation like this?
Okay, so Bristol Dementia Action Alliance, our aim is to make Bristol the dementia-friendly city of the UK. And we do that by running dementia awareness sessions. We run workshops for people working in the community who work with people with dementia and their carers. We can also help people make their premises dementia friendly. And we also work with all the organisations and agencies within Bristol, and probably a little bit further than Bristol, to help bring this about. Why did we join BDCN? We joined because we're three small charities, but we've got different objectives, but together we can pool our resources, we can pool our experience, and perhaps get a broader thrust, if you know what I mean.
Brilliant, thank you. And I think from a life point of view, it's, working together, I think it's, the collaborative work in Bristol was happening anyway before lockdown and before Corona, but it's been brilliant to see it broaden and become a real integral part of the way that we're working, and can support people in a much deeper and profounder and more powerful way, I think. So it's a real privilege from us to be able to work with you two as well, and we'll see where it goes from here. Obviously, the webinar we've got today is about supporting young people with dementia and their carers. We feel it's a really important topic to actually look at and to be able to support. Very often, I think dementia is associated as an older person's disease. But actually, out of the 850,000 people that are living with dementia, we've got 42,500 people who have young onset dementia. And they think that's probably up to about 6 to 9% of people. I don't think there's enough talk about it. There's not enough support and not enough understanding. And we feel it's really important to highlight that, to work out what's going on and to see what people actually need and to ensure a good conversation. So that's why we're here today. So first of all, we're going to hand over to Jo, and she's going to be talking for the next 10 minutes, Jo, and I will wave at you when your 10 minutes are up, if that's okay, because I'm a stickler for timing. So you're going to be talking about the complex needs of young people with dementia. So over to you, Jo.
Hi, thank you. Well, I'm just going to give a little bit of background about the service I used to manage. So my name's Jo O'Neill, and I used to manage the Limes in Kingswood, Bristol, which was specifically a day support service for people with young onset dementia. It opened in 1996 and was run by the Alzheimer's Society. And then in February, we transitioned to Southern Brooks Community Partnership. We closed for the pandemic, because of the pandemic, on the 18th of March. And then unfortunately, in Easter time, Southern Brooks, unfortunately, had to make the decision to close the Limes permanently. Tony's asked me to kind of reflect on the impact of that. And why it kind of came about. So since I was manager, I became manager in 2007, and at that point when I started, younger people were fully funded by the local authority to attend the Limes. So basically it was free to them at source. But then over the 13-year period, lots of changes came about in social care and the way in which it was funded. So lots of social care reforms from the government, reduced funding from central government to local government for them to fund services. And then of course we had the economic downturn, which brought about more change from local authorities, where they had to do more with less money. And this did have an impact on us, and actually had an impact on people with dementia, because they had to come to terms with the fact that where services used to be free, they were now going to have to pay either some or contribute towards their care, either from their income or savings. And bearing in mind, we're talking about working age adults, that would be around their income. There was another significant change a couple of years ago from Bristol City Council, where they looked quite thoroughly at day support and how they were going to pay for it. And one of the decisions which was made was that they weren't going to pay for absences, and that had a huge impact on the Limes, because we were, making a loss if somebody was not attending. So that was really difficult for us. So as I said, people had to come to terms with the fact that they were now going to have to pay or not. So, younger people might decide, well, no, I'm not going to pay a fee per day. I'm going to go off and do my own thing, which, it's great. That's what people should do. They should be doing their own thing. But what that meant was we went from a financially stable day support service with the waiting list to more precarious, and the waiting list started to disappear. And then the referral process started to get longer because local authorities and social workers were now working in a different way. So the access into our service was much slower. So the turnaround of clients leaving and new clients starting was taking longer. And the other impact on us was that people waited until they really needed us for support. So our clients had more complex needs, usually by the time that they came to our service. Now, the positive side of that is we became quite skilled in supporting those people. And I believe that they benefited from what we did. Well, I don't believe, I actually know. I can prove that people benefited from coming to the Limes and having an enjoyable time, being well cared for, loved and respected, and being treated with dignity. Everything that any human being needs, actually, but people with dementia just need that extra bit more. So our skill level really went up to meet that need. However, nobody could have predicted that we were going to have a pandemic, and there was just no going back from that, really. And unfortunately, this high standard service has been lost. I don't know whether it's a permanent loss, whether in the future we could do something, but I'll come on to that in a minute, because I think that's maybe something we're going to think about today. So I don't know if somebody's going to talk about the prevalence of people with young onset in Bristol and South Gloucestershire and North Somerset, but it's estimated to be that there's around about 1,000 people in those areas that have a diagnosis of dementia. And all of those people will experience lots of challenges. So the first one being actually getting a diagnosis. Anecdotally, you know, we hear about people taking 4 to 5 years to get a diagnosis for young onset. And when they get that diagnosis, not always, but quite often it is a more rare form of dementia. And that means that there is really quite challenging for them individually, challenging symptoms for them to have to learn to live with or cope with, or find ways of supporting themselves and managing. So it could be changes in personality, speech and language difficulties, comprehension of language, you know, understanding what somebody's saying to you, recognition of objects or of people, faces are not familiar anymore. And then loss of skills. So, for example, I worked with a guy who was a carpenter, and he told me one of the first things he realised that he had a problem was he tried to make a mitre joint, and he just couldn't do it. He said, I just couldn't see it anymore. I wasn't able to do it. The other thing about younger people is at the point of diagnosis, they could be working. So then they go on to lose their jobs. And, you know, I've lost my job. I know what it feels like to lose your job. It's your sense of identity, your value, where you see yourself in the world. It's a big hit. So on top of getting this diagnosis, you've got a huge change in life to deal with. Financial commitments for a younger person, they may be paying a mortgage, have loans, have dependent children. Children are, you know, it's all over the news at the moment, but children going off to university. You know, that you want to continue supporting your children in what they want to do. The other thing to think about is that younger people are usually, not always, but usually more physically able. So suppose a person with young onset, we need to be thinking about how do we maintain that person's physicality, help them support themselves and keep healthy and well. Accessing services is, you know, still quite difficult. And I'm thinking about GP appointments, doctor's appointments, but also applying for vet benefits. Anybody who's done that knows it's a minefield. You know, how do we support somebody to do that? And there's also still, unfortunately, a lack of awareness about young onset dementia. So friends, families, work colleagues, employers, other professionals that you're going to come into contact are still surprised when they're faced with somebody in their 50s who has a diagnosis of dementia. So there's still work to be done there. And then, of course, lack of services which are age appropriate. Although, you know, I love elderly people, I wouldn't want to spend all my time with somebody in their 80s and 90s. I would like to be with people of my own age. People in their 50s and 60s are very young and they've kind of got it going on now. So we can't all be lumped in one box. That's not right. So thinking about the future and what we've got at the moment in Bristol, South Gloucestershire and North Somerset, I'm only aware of a younger person's cafe that meets in Bristol and a group called Activate in North Somerset, where they meet together and go off and do nice things together. So hopefully we could start thinking about, once things have eased up with COVID, that we could think about the future and what we might be able to develop in our local area to help specifically to help and support younger people. And of course, you know, in my head, I've got a dream that maybe we could do something similar to the Limes, but actually do it better. We could go up a notch and find the right place, do a kind of social group with support for younger people.
Thanks, Jo. That's great. That's absolutely brilliant. And I know how hard it's been. And I think, you know, the Limes is so missed. And I know professionally just what an incredible job you did and what a difference you made. And it is such a loss. And I think it's why it's so important. And it's one of the reasons why we've done today, to keep that talking and to keep, you know, to see how we can make a difference. One of the things that you raised was obviously about being in the workplace, and people often, you know, when they're diagnosed and with dementia, they're very often still working. So we're going to hand over to Mark now from Brace. He's going to talk a little bit about dementia in the workplace.
Thanks, Isobel. Almost forgot to unmute. As I explained in my introduction, Brace is working with others to share the wider public knowledge, with the wider public knowledge derived from research, which is why we're working with our partner Charities this morning. One of the initiatives we've taken this year is an online meeting called Dementia in the Workplace. And this has been run so far on 2 occasions, each time with management training specialists, a dementia doctor, and a solicitor with relevant personal experience. And the audience consisted of invited HR directors and managers. The thinking behind this is simple. Dementia doesn't wait for people to retire, but the world of work, by and large, isn't up to speed with this. HR professionals need some understanding of what dementia in its various forms can do to people. They need to know how to respond if somebody comes to see them and says that he or she has a diagnosis of dementia. It might help to be able to spot some of the signs, though we are not trying to turn HR professionals into amateur doctors or health workers. Above all, they need to ensure that their organisations have employment policies and practices that are supportive and inclusive. Now, if I say to you, this audience, that a diagnosis of dementia is not a reason to stop working, I will be preaching to the converted. And depending on how the person is affected, they could continue to perform at a very high level, whether or not they need modifications to their job. So we want to help foster a deeper understanding of these issues, encouraging employers to become more dementia friendly in their practices and to see an employee with dementia as a unique individual with a unique experience of that condition. And the meetings we've held so far suggest that for many HR professionals, this is a whole new issue, a whole new perspective on dementia and on their workforce, but also that they are willing to engage and be supportive. And a related issue, of course, is carers in the workplace, people who themselves don't have dementia, but who need greater understanding and more flexibility from their employers. And in both the meetings we've had, it's highlighted the need for better staff policies and procedures and communication and workplace culture. And the response from the HR directors and managers has been very encouraging. One large firm that attended was already starting to become aware of dementia amongst its own staff because of some issues they'd had, and they were looking for exactly the sort of advice that the meeting generated. So to finish, if anybody attending this meeting knows any HR professionals, in-house directors, managers, anywhere in the UK, please put them in touch with us and we'll make sure they're invited to the next meeting. Thank you.
Brilliant, thanks Mark. I think it's so useful to be able to support and help people in the workplace and to continue working as long as they can. So I think this is a really important issue. I'm going to hand over to Tony now. Tony is going to talk about the issues for young people with dementia. So over to you, Tony.
Tony, you're on mute.
Sorry, can you hear me now?
Yeah.
Yeah, okay. Right, yeah, could you put the screen up of Kaz, who has actually worked in a support group that helped young people with dementia. When we talk about young people with dementia, by the way, we're talking about people of working age, sort of 18 to 65. Okay, so can everyone see a photo of Kaz? Because I can't.
Hi.
There we are, she's on there now. Okay, so Kaz, you've actually worked in a support group dealing with or helping to support people with young people with dementia. What sort of group did you get involved in and what did you do? What sort of issues came up for you?
Okay, so the group actually started before I joined the service. It was Sonia, I know, is here. So if Sonia wants to jump in and say anything, then go ahead, Sonia. And when I joined the service, because I had personal experience, my mum was diagnosed aged 56. So I had an interest in young onset. So Sonia invited me along to the group. It originally was well, the idea was when they started the group was to move away from your usual memory cafes that are generally church halls, community centres, and geared towards older people more. And so they used a bar in the centre of town. It was Roll for the Soul, and then we moved to Bambalan probably about 3 years ago now. And the idea was to create something quite informal. The idea being, if somebody came in and saw the group, you wouldn't know this was a group for people with dementia. So we have a section hired off in Bambalan, which they always keep for us on a Monday afternoon. So it's quite quiet in there. And it is just an opportunity really for younger people to mix with people in the same situation as them. And it links in with a lot of the things that are already spoken about, the differences when you're under 65, you know, the issues in terms of benefits, in terms of employment. And it gave the opportunity for people in those situations to share ideas really. Often you'll find that something comes up benefit-wise and somebody else has had that experience. So it's sharing ideas and it's sharing that support as well in those challenges. We get people coming from outside of Bristol as well, because there's just nothing else any closer to them. Some people come on their own, some people come with a partner. And what we find as well is that emotionally, for the person with dementia and for their partner, it makes a big difference being around people of similar age. What a lot of carers have said is that it's very hard for them to relate in the same way to carers of people in their 80s who are in a very different part of their life really to when you're diagnosed in your 50s and dealing with that diagnosis. So the emotional support they get from each other in that group. In the same sense, you know, it's very informal and unstructured, so it's not, you know, all about dementia. It's very led by the people there, but they do get a lot of support from each other in terms of the issues they're facing and that just emotional support really.
Okay, so how did COVID-19 affect you?
Wow, the group hasn't been able to run, unfortunately, since then because of the restrictions. So again, it's very difficult.
So are you keeping in touch with any of the folks that used to come along, or?
I know there is, yeah, and again, Sonia does a lot of work individually with the young onset people within our service, and all the practitioners and navigators are in touch with all our service users anyway. So yeah, there is a lot of contact with them, and I know that the people who need that more support, they'll kind of be getting that.
Okay, thanks, Fred.
Tony, can I ask Kaz, is there a possibility, do you think, of actually running it online and doing a Zoom group?
I know that has been spoken about. I don't know personally in terms of what, you know, plans there might be for that, but you know, I know it has been spoken about.
Because that's something that we could always, you know, when we were talking about ideas and taking things forward, that we could always look to. Because, you know, I know that for older people at the moment, you know, older people that we're working with, that the digital support is becoming really, really vital. And I think for people who are younger, they're probably a lot more digitally savvy and sort of more confident with Zoom and tech. So it could be something that we could look into and to do going forward.
Okay. Right, okay. Well, I wonder if you could put the screenshot of Julie up now, because Julie and her husband Andy used to go to a young people's support group. And I wonder if Julie can actually share some of her experience with us. So can we have a...
Yeah, so I think it does automatically, Tony. So I think for me, I started going to those groups, and I recall Sonia. But for me, it was really difficult because my husband wouldn't have gone on his own. And I was still working full time, and it was impossible. I was having to take leave to go to those groups. And literally I work in town, so I was whizzing home, picking him up, whizzing back down again. And it just wasn't feasible for me to continue to do that with him. So we kind of missed out on a lot of that. And in terms of, someone's just mentioned about doing it via Zoom, which is great, I think, if you've got a partner that could do it, but certainly Andy wouldn't have been able to use a computer at that point. And just I just want to pick up on something that you've said, Mark, and Joe have said about the workplace. So Andy was made redundant in 2010, but he was diagnosed 3 years later. Had he not have been made redundant, he would have actually probably lost his job for other reasons, for performance type issues. So it took him a long time to get that diagnosis, and it wasn't recognised that there were sort of those problems going on. Just to pick that up.
Yeah, it's a real shame. It's all a matter of timing. A number of times people said, I wish I knew what you told me 10 years ago. Well, I think we all say that because things were a lot different 10 years ago. I mean, in our case, it took Barbara 10 years to be formally diagnosed because she had young onset dementia too. So, okay, thanks, Julie. I wonder if we can put the photo of the slide up, because several people have mentioned some of the issues on here. Okay, now some of these issues for young people with dementia have been mentioned already. Joe mentioned the embarrassment and the stigma that a young person with dementia has. They lose their friends, or their friends say, you're too young to have dementia, that's an old people's condition. Well, sad to say it's not. Young people, as we've heard, do get dementia too. And of course, for the person with dementia, they say to them, well, you know, my life is over. All my friends are gone. What am I going to do about my job? Well, their life isn't over. I mean, Barbara, for example, have had symptoms of frontal temporal dementia for 21 years. And by keeping our brains active and by keeping physically active, eating the right sort of things, we can still live. Maybe not as we used to live, but we can still live. Job security, can they still do their job? Well, I heard a heartening story about a lady who worked for Sainsbury's, and I'm quite happy to mention their name, because this lady was still working and she had dementia, and it was noticed by her colleagues that she couldn't do her job. So did they sack her? No. What they did, they had a little meeting with her and said, well, what can she do rather than what can't she do? And they moved her onto a different job that she could cope with. And they actually moved her from job to job for 5 years until in the end, her dementia got so bad that they had to medically retire. But they gave that lady 5 years more work, which kept her self-esteem at the top rate. And as we've heard from Julie and as we've heard from Joe, young people with dementia have financial worries. They've still got to pay their mortgage or their rent. They've still got other monies that they have to pay out. So that's a worry for them too. Dementia groups don't necessarily cater for them. They're generally geared towards older people. I mean, when I first took Barbara along to a day centre, she said, I don't want to go to some old people's day centre, that's for geriatrics. Well, when we went, we actually discovered that there were 2 other couples that joined within 6 weeks of us joining, and we all like walking. So we set up a walking group. And so 1 week we would go to the day centre, which met fortnightly, and the Tuesday in between, we used to have our walking group. So 1 week we'd go to the day centre, the next week we'd go for a walk. So we can think about dementia groups that can actually be interest-based or hobbies-based or something like that. Music, we're not all into Vera Lynn. And when you go to a group, generally, or it used to be the case, that music was generally geared to older people and, you know, they'd love the old songs. Well, I mean, Joe's an Elvis fan, so if you used to go over to the Limes, you'd get a lot of Elvis. Isn't that right, Joe? So, you know, we do younger people with dementia do like more modern songs. And even when we go to Singing for the Brain, it's not all Vera Lynn and It's a Long Way to Tipperary. We do sing other songs as well, more modern ones. And Julie's mentioned the need to meet with peers, and Kaz mentioned the need to meet with peers, because we generally like to associate with people of our own age, people that have got the same interests as us. we can talk about common issues, can't we? And as I say, we can concentrate on what they can do rather than what they can't do. Let's be positive about this. And they may still need to take part in an active pursuit or hobby or interest. And Isobel was talking earlier on about the fact that Alive have now got an allotment not far from where I live, and people with dementia are invited to go along and grow some vegetables. Well, that's a good man activity, because with the problem with some groups that meet for people with dementia is you sit around and you do activities that might be, dare I say, female based, like it might be colouring, or it might be making Christmas cards or birthday cards. You'll find that a lot of blokes are not interested in that sort of thing. That's kid stuff. They don't want to do that. What they want to do is they might want to use their hands, or they might want to use a skill that they've had. And so something like gardening is something where they can go down to the allotment, have a chat with the boys, put a bit of hard manual work in, and that's something they enjoy. They might even go down there with a flask and have a cup of tea. And of course, technology, we've heard earlier on again that younger people are more tech savvy. Older people are generally resistant to, well, not generally, but some of them might be resistant to technology, where younger people are brought up with it. You know, it's the old saying, isn't it? If you want something, if your computer goes wrong and you want it sorted out, go and find the average 7-year-old. So these are some of the issues with young people with dementia, which brings us on to the question, okay, what is being run in Bristol and surrounding area at the moment for young people with dementia? And as we've heard, there's a couple of things going on, but not a lot. So that raises the question, okay, what could be done? Which raises another issue, okay, what do we need to start? What could be done? And when could we start it? And here I hand over to you. And if you've got any suggestions, ideas, if you'd like to write them in the chat box, then we can share with everybody what could be possible. One at a time, please.
Yeah, Mark, can you just take off the share screen, and can you take off the, yeah, so we can see everybody, so I can see where people are raising hands. Julie, do you want to have a...
Sorry, yeah. Yeah, I just want to raise the issue that I was very, very lucky, because I had a couple of professionals that were incredibly kind to me and Andy. But carers groups, etc., all of that is during the day, so I wasn't able to access any real, what I would call real sort of support. It wasn't those professionals' job in terms of supporting me, but they did a fantastic job, and I'll eternally be grateful to them. But that's missing. And the other thing, in terms of thinking about sort of dementia groups or activities, the other issue is about transport. My husband, I'm sure some will be able to get taxis, etc., that sort of thing, but my husband wouldn't have been in a position to use a taxi, even if it was a disabled one. He just wouldn't have accessed anything on his own. He would need that introduction to something new, and he would need to have transport with someone comfortable that he knew well. So that was quite a big thing for him. He was sort of, I was lucky, because I found a day centre for him, but when I went to one initially, it was impossible because there was no transport provided. Luckily, I found something locally that was able to sort of help him for sort of 2 days a week. But realistically, I was at work, and when he was coming back, as things progressed, he was starting to wander afterwards. Now, he wasn't, some people might sort of think, well, actually, at that point, should I not have sort of considered, you know, sort of a full-time care placement? But he was in no way ready for that. That wasn't something that was needed. And equally, trying to find a care placement for someone with his sort of in his sort of situation, his age, etc., etc., it just wasn't a sort of feasible option for him. And in hindsight, knowing what I know now, when Andy was diagnosed, I knew nothing about dementia. Didn't have a bloody clue. But knowing what I know now, I know that had I have put him into care at that point, he would have had to move again as the illness had progressed. So that's that kind of financially, really, that's, you know, just as a society, it's another issue, I think. Sorry, I just wanted to raise those points because some of it is really important, because I managed to hold a full-time job during all of this, and I'm really grateful. But others that perhaps haven't got the fight, it must be so difficult for people out there. As I say, I was very lucky. I had two very good people that were able to support, that were helpful.
Brilliant, thanks,
Shut
Julie.
up now, sorry.
No, I think they're so important to share, because you know, it's the time appropriateness and the transport, and it's really vital that the services are there. So is anyone else got anything in terms of what's out there at the moment in the Bristol area and what we can do? Does anyone like to raise their hand and take themselves off mute, because I can't see everybody at the moment?
Could I just mention that we the other change, I don't know whether you can hear me, but the other change is that people are retiring later now. The government expectation is that I think the retirement age will be 67. I being cynical, I think that will be moved to 70 very soon. So there's going to be more people that are going to need support. So I think we need to factor that in. And I agree, we need to think a bit outside the box. You know, this is really about working with younger people and understanding the difference that partners are going to be working, they've got commitments. So what we need to change, that the family doesn't need to change, we need to change what we do to support them so that they can continue to do what they're doing. So yeah, we need to think about evenings and weekends and, you know, make it more accessible. Thank you.
That's brilliant. Annie's come up with some brilliant ideas: art groups, movement, walking, wildlife outdoor groups, memory cafes that meet in the evening, memory shed. I think all of these are absolutely fantastic. Yeah, and I think they're all in Wiltshire. So I think that we've got a lot of people from different areas, which is absolutely fantastic, and it's really good to be able to share those ideas across the board, I think. Edward came up with a question, actually. Is there a prevalence of misdiagnosis of young onset dementia for other issues such as severe depression and perhaps other psychological disorders? Can anyone answer that for me, do you think? Tony, you've got your hand up, go for it.
Yeah. Barbara first had symptoms in 1999. It started with her when she couldn't remember our children's birthdays. And she said, what mother can't remember her children's birthdays? I brought them into the world. So I said, well, if you're worried about this, let's go and see the GP. So we went to see the GP, and we went to see the GP probably 3 or 4 times, and he put it down to depression. And I said to him, she's not depressed. She might get fed up occasionally, as we all do, but no way is she depressed. I know what clinical depression is because we had it when, sad to say, our eldest daughter died at the age of 6, and Barbara and I were both really affected by that. So I know what depression is. And Barbara used to get fed up occasionally, but there was no way she was depressed. So yeah, in answer to your question, Edward, can there be a misdiagnosis sometimes? In our circumstances, absolutely. And she wasn't formally diagnosed for 10 years. And in the end, we had to go to UCL in London for her to get a formal diagnosis that she had frontal temporal dementia.
You've been amazing looking after her, Tony, and I know how hard that was. So in terms of being able to put more groups on in our area and where we kind of go from now. I think obviously we want to see more support. Has anyone got any ideas for, I suppose, groups that we could start? I mean, there's some wonderful sort of creative ideas. Tony, what do you think we need to do to set up new groups and new support?
I think the first thing we need to do is identify the young people with dementia in Bristol or wherever we live, because there's people on here from all over the country. I think the first thing we have to do is identify those people, young people with dementia in our area, and then get them together and talk to them and say, well, what would you like? You know, it's not us saying this is what we can provide, take it or leave it. We need to consult them and say, as young people with dementia, what would you like to happen? What sort of support would you like? What sort of activities would you be interested in? And then when we get the ideas from them, then we can think about, okay, well, how can we go about perhaps supporting this? And the other thing I would say is that I think the young people with dementia need to run it themselves. We can support them, but it's their group. They run it, because that will help their self-esteem as well. Because people with dementia say, I can't do it anymore. Yes, they can. And if we get them to do what they can do, rather than worry about what they can't do, then that group is building their self-esteem, as well as maintaining their self-esteem, I should say, as well as actually meeting their needs, to meet with peers, to actually get involved in hobbies and interests, and that sort of thing. So in my view, I think we need to identify who these people are, get some sort of meeting, whether we can actually meet face to face or whether we do it on Zoom. And as someone said in the chat, not all young people can operate Zoom. I totally accept that. We're not all tech savvy. Some people are frightened of technology. I accept that. But, you know, let's look at what we can do rather than what we can't do.
I love that phrase, and I think that's so true for everybody. So I think we do need to do that. And I think obviously now the issue that we've got is that, you know, bringing lots of people together in one room. We can't do that. So realistically, the only option to a certain extent is the digital. But unless we talk to, you know, we use Bristol Dementia Wellbeing Service and people who are actually dementia navigators, and actually form some kind of sort of get their support and get them involved as well. So it's going to be a collaborative effort, which I think is so important, and I think that's one thing that we have discussed actually.
Talking about the Dementia Wellbeing Service, we've got good contacts with the Dementia Wellbeing Service. Is Wendy on here? Wendy Stewart.
Yes, hi Tony, I'm here.
Hi Wendy, you know what's coming, don't you?
No, what are you going to ask me to do?
Right, well, when Wendy was on one of these Zooms last week, and there's talk about setting up a carers group in there.
Yes. We are. Yes.
Do you want to tell us about that?
That's not specifically for young onset. It's for carers of all dementias. But yes, we are just setting up a virtual group, just starting it, because already Alzheimer's already are doing our activity groups and things virtually, but we haven't actually done a carers group virtually. So we're just going to be starting it, trialing it next week. But it is primarily for members of carers that are within Dementia Wellbeing Service rather than anywhere else. So it's carers of our service users.
Okay, so could the Dementia Wellbeing Service help us to identify these young onset people with dementia? Also, the group that Sonia talked about, obviously they're young onset people with dementia there. Could we identify who this group of people are and get some sort of gathering, whether it's on Zoom or, as I say, face-to-face seems in the far distance at the moment. But
we can contact them. Obviously, we can't give their data to you, but we can contact them and offer them anything that's obviously available, which we do anyway. So we know who they are, and as I say, Sonia's our young onset practitioner. Yeah, of course we can contact them. Yes.
Okay, if we could switch to Sonia for a minute. Sorry, no, nothing personal, Wendy.
No problem.
Isobel, when Sonia's done, just to let you know, Sue's got her hand up as well.
Brilliant, I haven't seen Sue, thank you.
Yeah. Just tell me when to stop talking and then somebody else can have a go.
Stop talking, Tony.
What do you want to answer? Oh, it's Sonia.
Yeah, one of the problems with identifying young onset dementias is once someone gets over the age of 65, if we were to do a search, it sometimes becomes very difficult to identify those people. And also I am aware that when it comes to GPs, their classification of young onset dementia only sits with people with Alzheimer's.
Right.
So it excludes a lot of people with vascular, frontal temporal, and all the other rarer types. So it's actually quite difficult. About a year, 18 months ago, the Dementia Wellbeing Service tried to do a screen of all the people that we've got on our caseloads. And unfortunately, we were only able to identify a certain amount simply because of those people. I'll use your wife as an example. She probably wouldn't get flagged up as someone being young onset dementia, which is something that we need to clarify, is that once you get over the age of 65, you are still a person with young onset dementia because it's at the point that you got diagnosed. It's not relating to age per se. So there's quite a big grey area of people which wouldn't be captured.
Right.
If that makes sense.
It makes total sense, although it seems odd. So what could we possibly do about that then, to identify who the young onset people with dementia are?
Maybe it's the other way around, Tony. Maybe build it and they will come.
Yeah.
So maybe we need to think about starting something and advertising that and getting people to come to us.
Yeah.
Yeah. Well, I think if we will, yeah, I think you're probably right. I think we do need to start that. But Sue, you had your hand up as well, didn't you? Do you want to?
Thank you. Yeah, I just wanted to really emphasise the value that the Lines had and how different that is to other smaller scale groups. It's all have their value, but anything that's only an hour or two is not doing the same job as providing daycare for the carers of young onset people like myself. So I there for a year and a half or so, had a fantastic time there, and I kept working, and it was open 8 till 6 so that carers can actually do full days on the days they're working. And it was fantastic, and I valued it so much. So I would be up for doing anything I can do to help make something happen, because I was devastated to hear it wasn't available for carers and sufferers now. Yeah, people who are living with it now. But it was absolutely great. Yeah.
Well, thanks, Sue. It's good to hear how much you appreciated it and how much value it had. I think it's so important to get those testimonies when we're building a case going forward, and it shows that that need is there. Has anyone else got anything else they'd like to add into the conversation?
Can I just add something?
Yep.
Yeah. I've been listening to this all the way through, and it's been really, really interesting. And I think what we've got to take from it is a can-do attitude.
Yeah.
We've got to take out what can we do, as Tony said. It's not what hasn't happened in the past. You know, we can't change the past, but we can change the future. And we need to have more people with ideas. We need another Zoom like this. We need people to go away today and write their ideas down, and then come back to another Zoom like this and say, yeah, this is what I'd like you to do. Because I've been to so many conferences where they've had ideas trees and they've had whiteboards and stuff like that. But there are all these ideas, but 12 months later, if you ask anybody who's been to that conference, what made a difference to you in your life regarding dementia because of the conference, they will say, none. Because nobody's actually acted on those ideas. Nobody's accountable for those ideas. So what I think we should do is stick together, There's a brilliant organisation in Oxford, and she's already been on, Kate Fallows, Young Dementia in Oxford, and they've been going for years and years. You need to collaborate with them because they've got some fantastic ideas. The Bolton Dementia Support Group are working with people and have done for young people for years and years. There's so much out there. We really do need to have a can-do attitude. We need to come back to the table and say, right, listen guys, I've had this idea. What do you think about this? And then take it from there. I was diagnosed 12 years ago, and I'm horrified to think that things haven't changed in the last 12 years. Because when I was diagnosed at age 50, there really wasn't anything out there. And especially for somebody at age 50, nothing at all. You know, things have changed. There's so much more we can do, but things have changed. So I think we need to get these ideas together, but we need to be accountable for them. Not legally, but accountable for them and say, right, I've had this idea. I need some more ideas to go with it. Right, who can help me? And let's act upon these things and let's see what outcomes we get.
Mm-hmm. That's brilliant. Thank you, Norman. As ever, you're so inspirational. And I just think the way you talk, you're such an example. And yeah, I always get moved when I hear you speak. So thank you. Yeah, we've got 2 minutes left.
Well, there's Mr. Qureshi would like to speak. He's got a card up.
Yes, please. Yes, please. Yes, please.
Behind my chat.
Thank you.
I do apologise.
Thank you. Thank you. Thank you. I am in Stoke-on-Trent. I have been living with FTD since 2011. I'm involved in different organizations, mainly with DEEP and Alzheimer's Society. But I feel that more people with diagnosis of this condition should be on payroll, and they should be sitting there and actually passing on their experience. And I have worked quite hard with this issue, and I've got the GPs now thinking in my way, and we're working together in Stoke-on-Trent. But I feel that we need to be listened to, and we need the GPs, the so-called professionals who know it all, need to listen to us and take notice, and maybe working together, we might achieve something. It's bad enough knowing that you've got a disease that as of yet, you've got no one cure for it. And then having to sit there and just listen to them, and they just tell you, I am diabetic, I have my diabetic review, I have a problem with my eyesight, I got an appointment through there, but no review on my dementia has ever taken place in 2011.
Oh, wow.
So I think that, something needs to be done in that area.
Definitely. Thank you. We really appreciate your input, actually. And I think we all need to think, because I've been amazed, actually, at how many people are not just from the Bristol area, because obviously we're the Bristol Dementia Charities Network. And actually, it's amazing to hear from different areas of the country what's going on. But I think we need to think about it on two levels. One, what are you going to do in your local area to actually have that support, and that we do more on a national level and how we contribute more. So I think it's kind of those kind of things that we need to think about. I just really want to thank everyone for their input today. I really hope it was really useful. And we can go from there. I think people just need to make a commitment. And I think for people in the Bristol area, we will do another meeting where we can talk specifically about what we can do in our area. And then hopefully we can do another one on this maybe in a couple of months, but look at more of a kind of national level and people can feedback. Mark and Tony, is there anything else you'd like to add?
There was a question somebody put in the chat just now saying, what are we doing next month, and can they book on? We're planning to do something pretty much on the same lines as this one, just to get more people involved in the conversation. Inevitably, it will turn out to be a bit different. There'll be different input from the audience and nothing else. But yes, it is available to for booking. You can find it on the Brace website at least, and feel free to book now. Is that exactly the same base as this month's? Thank you.
Tony, is that anything else you'd like to add?
Although we are repeating this next month, that doesn't mean to say we can't think of ideas in between times. So if anybody has got ideas, suggestions, you know, send an email to either Brace or Alive or BDAA, to one of us, and we'll share it together, and we'll have a chat after the next one in October, I think, and see how we can move forward, because this is such an important subject.
Yep.
And as has been said, you know, we really do need the medics to take notice of carers, because very often carers are ignored. But as I've put in the chat box, I've got a meeting, I've got a workshop with the CCG tomorrow where I'm going to raise this. Yeah, I could go on, but I won't.
Okay. I've got a question from Akomo, just saying, does anyone know what's happening with the BME community, in the BAME communities in Bristol? Tony, have you got any idea in terms of?
Yeah, we've got a worker that works with us or for us in the BAME communities, and they've just 13 BAME community groups have just been awarded a grant by the government to actually work and raise dementia awareness within those communities. And we're fortunate that we've got someone who works with us, who works along those lines. So yeah, we're totally in touch with BAME communities. In fact, we've run a workshop with them, and they've taken away what we suggested. They've made it suitable for their communities, because the best people to speak to their community is them, you know, not us. And so they've taken away what we said and translated it. That's not the right word, but you know what I mean. They've changed it into their culture so that they can talk to their own community in language they understand.
Brilliant. Thanks, Tony. So I think we'll draw it all to conclusion. I think for me, what I've really gathered is that we need to move this forward, that a lot of things need to be more appropriate for people who with young onset dementia. And there is such a lack of awareness and a lack of services and support, and we really do need to move this forward and see, and you know, in the Bristol area, but also on a wider national scale. So thank you all for your time. It's been brilliant. Yeah, we really appreciate you coming and spending your time and hearing your insights. And yeah, we wish you all the best for the rest of a Monday morning. So